Texas often puts Band-Aids on things that require surgery. And that has historically been at the detriment of women's health. And right now, I would say, knowing that here in the States, we're under maternal health crisis, a crisis, extending Medicaid to 12 months is the least that we can do. It's really the basics. Healthcare is a human right. And if we put the pressure on women and birthing people to carry children and raise children and take care of children for the next 18 years, then we need to make sure that the people that are carrying these babies and raising these babies are cared for. I'm not sure if many people understand that the vast majority of maternal deaths happen after birth. And 80 to 90% of these deaths are preventable. And so this just seems like if we know that we're in a healthcare crisis, then we need to get to the root, you know? And Black and Indigenous women are 2 to 3 times more likely to die from childbirth-related causes than white women. And I want people to also understand that, like, what a pregnancy-related death, like what it's one that occurs while pregnant up to 1 year postpartum for any cause related to pregnancy, that any cause related to or aggravated by pregnancy or its management. Okay, so up to 1 year. Okay, so just imagine someone, just kind of give you an idea, imagine someone who is 3 months postpartum, Medicaid has run out. This is no longer baby blues. This is depression or psychosis. This parent maybe wants to continue breastfeeding, but is having a lot of challenges and doesn't have the care and the support needed to continue on their breastfeeding journey. Having extended Medicaid, a basic human right, really, healthcare, can already reduce the level of stress that occurs when someone has just had a child, knowing that they can contact their OB-GYN up to a year after they've given birth to receive the necessary care that they need. Because a body is not done, hormones are all over the place. You know, a body does not just go right back to normal. It's time for us to start treating women and birthing folk like with the dignity and respect that they absolutely deserve, especially when we have placed the burden of responsibility on them to continue to raise a child and continue raising a child for 18 plus years, you know? So this is basic. My prayer is that people will understand the humanity, that they would be gracious, that they would see that people are deserving of kindness and gentleness and compassion and tender loving care. And this is basic. We haven't even got into cultural relevancy, cultural humility, cultural diversity, all of that. We haven't even gotten into systemic racism. We're just trying to provide basic healthcare.